Okay, so another question is a 27-year-old male underwent elective splenectomy in the morning. Surgery was uneventful. At night, his pulse is 120 per minute. Blood pressure is 90 by 50 millimeter of mercury. Urine output is less than 60 milliliter per hour. What is most likely issue? So after splenectomy, the patient has basal atelectasis, gastric perforation, portal venous thrombosis, or secondary hemorrhage. So the answer will be secondary hemorrhage. Because of secondary hemorrhage, we can look at the pulse of patient has been increased 120, blood pressure is 90 by 50 millimeter of mercury, means dropped because of hemorrhage, and urine output is less than 60 milliliter per hour, which is also less. So we can conclude that there is secondary hemorrhage to the patient. Another question is a 50-year male present with complaints of increasing darkening of skin. On examination, hepatomegaly is there, ankle edema, blood report shows hemoglobin is 13 and RBS is 240 milligram, iron is 35 micromole per liter, which is raised, and serum ferritin is greater than 500 microgram per liter. Ideal treatment of this patient would be deferoxamine. So deferoxamine is given for complications of the liver diseases, and it is ideal treatment for this patient. So deferoxamine should be given. While diabetic control is not treatment for the patient, diuretics is not treatment option, low iron diet is not the treatment option. Deferoxamine is definitive treatment for the patient. Another question is a child has acute respiratory infection. On physical examination of child, we find mediastinum shifted to the opposite side. Chest movements are reduced over that area, reduced vocal firmitas, stony-dull percussion there. Now, what is the diagnosis? Now we can see that stony-dull percussion comes in pleural effusion, but other suggestive features of, let's suppose this is chest, and what happens, this is mediastinum, what happens, this is right side, this is left side, and if there is pleural effusion of the right side, trachea will be shifted to the opposite side, means left side. So one justification for pleural effusion is the opposite shifting of trachea. Vocal firmitas will be decreased, and decreased breath sound or on that area will be there. So in this way we can conclude that this is pleural effusion. Consolidation is not there. Bronchospasm does not present with this. Atelectasis does not present. Pleural effusion is the answer for this disease, because pleural effusion patient presents with stony dull percussion. So stony dull percussion is definitive finding for pleural effusion. Now another question is a 35-year-old para 3 weeks advice regarding oral contraceptive pills as a mean for contraception. Which of the following condition would be an absolute contraindicated for her? Absolute contraindicated for combined oral contraceptive pills is acute liver disease. In acute liver disease, a woman should not take contraceptive pills. Obesity is not uh, uh, contraindicated. Hypertension is not contraindicated, and smoking as well is not contraindicated. So the next question is, which is the factor which confers high immunity against measles disease in human? Booster dose of measles immunoglobulin? No. Booster dose of measles vaccine confers high immunity against measles. Single dose does not confers. Even single dose of measles vaccine does not confers, but booster dose confers high immunity. A 21-year-old man receives a knife wound that is severe at the root of C5 C6 of brachial plexus. The muscle most likely to be paralyzed with now C5 C6 nerve root of which muscle? C5 C6 is the nerve root of palmus brevis? No, it is not. Flexor carpi ulnaris? No, it is infraspinatus. C5 C6 damage will lead to paralysis of infraspinatus muscle paralysis, not palmar atrophy. So in this way, this muscle is paralyzed. Another question is a 20-year-old female present with urine present in outpatient department, the history of abdominal distension, vomiting, absolute constipation. for 24 hours. She has been such an episode of past 1 year, has noticed weight loss diagnosis. The ileocecal TB was made. What is suitable investigation for ileocecal TB? So suitable investigation will be colonoscopy and biopsy, because junction ileocecal junction is more prone to develop. Most commonly, abdominal intestinal TB occurs at ileocecal junction. So, what investigations will we perform? We will perform biopsy as well as colonoscopy. Biopsy and colonoscopy. Biopsy and colonoscopy is performed for ileocecal junction uh, tuberculosis. So, this is definitive test for abdominal TB. Now another question is, a 48-year-old housewife with history of gradual weight gain, feeding of cold, exercise, excessive sleep. She has menorrhagia, taking hormone pills. She now complains of paresthesias in her right thumb and first two fingers. Her pulse rate is 58, vested thenar eminence of right hand. She is diagnosed with carpal tunnel syndrome, most likely diagnosis or secondary to amyloidosis. No, it is not for that. Myxedema, yes, myxedema is the answer, not for obesity, even not for osteoarthritis. So in myxedema, what happens? All these features happen. Which type of features happen? Now, first of all, there is feeling of cold, weight gain will be there, excessive sleep will be there, menorrhagia, and paresthesias of right thumb will be there, delayed relaxation of ankle reflex, and carpal tunnel syndrome will be there. Myxedema patient. So in this way, this patient presents. When a person is in fasting state, her what happens? Gluconeogenesis is inhibited. No, gluconeogenesis is activated in fasting state. Basal metabolic rate decreases. Yes, the temperature also decreases. Glucose is only fuel for the brain. No, glucose is not only fuel. Liver glycogen level is increased. No, this is not uh, matching with the statement. Another question is, in a diabetic patient, the earliest sensitive test to detect diabetic nephropathy is diabetic nephropathy. Earliest test will be blood glucose level. No, it is not earliest. Creatine clearance is not earliest test. Glycosylated hemoglobin HbA1c is not the earliest test, but urinary albumin is earliest test, because diabetic nephropathy is there for diagnosis of diabetic nephropathy. So urinary albumin will be the best investigation for this disease. Another question is, a 8-year-old child was brought to emergency having profuse bleeding after extraction of deciduous tooth. Complete investigation. After completion of investigation, he is diagnosed as classical hemophilia. Blood analysis most likely show the deficiency of in hemophilia. What happens? Factor 9 does not decrease, but factor 8 decrease in classical hemophilia, not 7, not 12 or vitamin K. Factor 8 is decreased in classical hemophilia. Hemophilia A is the deficiency. Now let me tell you. Hemophilia A is deficiency of factor 8. Hemophilia B is deficiency of factor 9. So these both hemophilia are differentiated on this basis. Hemophilia A is factor 8 deficiency, also known as classical hemophilia. Now, if you pull a baby from lying, there is no head, leg, or baby hold, rattle briefly, and in response to the obvious pleasure of friendly handling, the most likely age of the child would be 3 months. This is about pediatrics and milestones. Another question. A 19-year-old married girl was diagnosed as having hypothyroidism. She is found due to dietary deficiency of iodine. Regarding iodine metabolism in this patient, uptake is influenced by posterior pituitary gland. No, this is not. Requirement is increased in adolescent. No, requirement does not increase. Requirement increase in pregnancy. No, this does not increase. Ingestion is essential for normal thyroid function. Ingestion of iodine is important for thyroid functioning. In this way, thyroid works. Iodine deficiency leads to enlargement of the thyroid gland. A 77-year-old man collapsed while shopping regarding consciousness. He complained chest pain. He has severe episode of collapse and chest pain on exertion is there. His blood pressure 120 by 95. He has ejection systolic murmur at left sternal edge that radiates to the neck. Most likely diagnosis is aortic regurgitation. No. Aortic stenosis is the most likely diagnosis because we can look at there is an ejection systolic murmur is a classical feature of aortic stenosis. So in this way aortic stenosis present. A 38-year-old woman complains of headache, diplopia. Examination, she has hyperpigmentation. Blood level fasting glucose are 60, serum prolactin is 100, ACTH is 10,000. The past history of abdominal surgery, most likely diagnosis is Addison disease. No, ACTH is increased. Cushing disease is not there. Ectopic ACTH production is not there. Nielsen syndrome is the classical diagnosis for this disease. In Nielsen syndrome, what happens? There is headache, diplopia, and there will be elevated ACTH, increased serum prolactin level will be there. So Nelson syndrome presents in with these features. Another question is a 38-year-old nulliparous lady has menorrhagia, severe dysmenorrhea, painful heavy menstrual bleeding, and dyspareunia. Per uteral vaginal bleeding is 8 week and uniformly enlarged uterus is there. What may be diagnosis? In adenomyosis, what happens? There is bleeding as well. Dysfunctional uterine bleeding? No, it is not. In endometriosis, these all three features are present and the fibroids having painless bleed. Now let me tell you the triad of endometriosis is dyspareunia means painful intercourse. There is bleed dysmenorrhea means painful menstruation, and menorrhagia means heavy menstrual bleeding. So this is triad of endometriosis. Now the question says she has dysmenorrhea, heavy menstrual bleeding. Dyspareunia means painful sexual intercourse, and menorrhagia means heavy vaginal bleeding is the classical finding of endometriosis. Another question is a 15-year-old girl has menarche 2 years ago. She is brought with a history of weight loss, amenorrhea, loss of cessation of menstruation, loss of menstruation. Weight is 65 kilogram. Trying to lose weight by jogging and dieting. Clinical examination revealed her height is 165, weight is 40, pulse is 56, which is dropped. Blood pressure is also dropped 90 by 50. She appears dysphoretic, but systemic examination was not remarkable. Most likely diagnosis of this patient. Addison disease? No, she has no any complication. Anorexia nervosa is there because she has mentally trying to lose weight. That's why she eats less, and anorexia nervosa has created such problem. Not malignancy or tuberculosis is there. An 18-year high school student is present with bloody stool, abdominal pain, low-grade fever. Symptom resolve spontaneously after 5 days. Most likely there. Now abdominal pain, low-grade fever, and bloody stool there. So intestinal complications are there. Acute gastroenteritis is there in this patient. Malabsorption syndrome, no bleeding is there. Ulcerative colitis is other complications like skin problems. Pseudomembranous colitis does not present like this. In this patient presents a 33-year-old male, non-diabetic, having severe diarrhea, urinary tract infection since 3 days. Serum potassium was found to be low, most likely cause of hypokalemia in diabetes or diarrhea. Is diarrhea is also can cause diabetes mellitus? No, does not cause. Diarrhea is the cause of hypokalemia. Most commonly, diarrhea causes hypokalemia because potassium is lost. No fever, no infection can cause hypokalemia. In this way, patient present. A 4-day infant has psychological jaundice. She is on phototherapy. Blue light reduced level of bilirubin in her skin. Which mechanism best explains the mechanism of phototherapy reduces jaundice. So with phototherapy, bones are decreased, increased conjugated enzyme in the liver, no increased synthesis of vitamin D, no malabsorption of the bilirubin, no conversion of bilirubin to water soluble form is important in phototherapy. So that's why we prefer phototherapy, and bilirubin level is decreased. In this way, patient presents